Thank you for joining us. I am Megan Phillips of the Train with Trust Project, here with Jody Ambrose, co-founder of the Train with Trust Project. And we are joined once again with Dr. Sue Dyson, who is so wonderful to share her time with us and her information with all of you. Today, we are going to be talking about selecting a vet, which we were just discussing beforehand, might have a lot of information that many of you, it might have answers for you that you didn't know that you needed to know. If you have questions during the chat, go ahead and pop those down in the comments. I'm going to be behind the scenes taking those down and helping out with that. So if you have questions, you can do that. If you're just joining us for these live conversations, we have done a number of these with Dr. Sue Dyson on topics all related to the 24 behaviors of the ridden horse in pain, shifting the paradigm of how we see lameness. That was a film that was produced by Podma Video in partnership with the Train with Trust Project. And that is available for free on YouTube. If you haven't seen that, be sure to check it out. The Train with Trust Project is a nonprofit organization, 501c3, and we are dedicated to making animal behavior education accessible to everyone. And specifically right now, we are focusing on horse behavior and really trying to spread the word about the 24 behaviors. And one of the resources that we have available that Dr. Sue has helped us put together and is available on our website is how to select a veterinarian, because a lot of people saw the exam being performed in that film and were curious about that. So I'm going to turn it over to Jody and Dr. Dyson. I'll be in the background, and let us know if you have any questions.
Okay, so this is a great topic, I think, for any horse owner, regardless of what discipline or what kind of horse you have, because pretty much our journey with horse ownership starts and ends with veterinarians. We usually start with a pre-purchase, and we all end up with meeting a veterinarian in the end of a horse's life. But in between, we tend to advocate for a team approach to horse care, meaning that you need a veterinarian, a farrier, a saddle fitter, a trainer, and other paraprofessionals who work together and communicate well. And so what we're going to talk about today is how to find that team member or the team members that you need throughout the horse's life, particularly as an athlete, that you need someone who's going to be able to keep that horse healthy and sound and feeling good so that their behavior can align with your goals and so that their welfare is optimal. However, I think a lot of horse people aren't aware that there is a massive shortage in the veterinary industry of people who specialize in horses. And so it can be really difficult to find a vet at all, much less the right vet. And so we want to give people some tools to sort of take steps to find someone that can meet their needs, regardless of where they are and what they're doing with their horse. Dr. Sue, why don't you start by talking about what are some of the things that need to align for a vet to be the right vet for you as a horse owner?
Well, I think we have to appreciate that horses are going to need routine medical care. So, for example, routine dental care, routine vaccinations, and they may sustain minor injuries that need attention, which are all going to be well within the remit of a general equine practitioner. We have to remember that as veterinarians, we went to vet school and we were taught about all species. And we may have had some ability later on in our education to do some degree of specialization with respect to horses, but only horses. We're not talking about specialization in specific disciplines within equine veterinary medicine. And equine veterinary medicine is an enormous field. What I know about equine reproduction, you could reproduce on a postage stamp. But that is a very, very important field if you want to be breeding. Even if you want to breed with a single mare, you need somebody who has expertise in reproduction. And it's the same when we're talking about performance horses. The most common problems with performance horses are lameness, or any types of lameness, or musculoskeletal pain. So you need to have access to somebody who has the skills in potentially dealing with more complicated issues than just a subsolar abscess, for example. A general practitioner should be able to manage successfully a subsolar abscess, but many general equine practitioners will not have had a broad education in a comprehensive evaluation of the musculoskeletal system, nor in all the nerve block techniques that we need to identify where the sources of pain are coming from, which are causing the poor performance or the lameness. And therefore, I think you need to have somebody local to you who is going to deal with your day-to-day problems and the routine healthcare. But when it comes to poor performance or a not straightforward lameness, so it's not nail bind, it's not a subsolar abscess, you may need access to somebody who is more specialized. And you can draw parallels with human athletes. If you were a human athlete with a sports-related injury, I don't think you would generally consult your local doctor. You would go to a sports medicine specialist. You might start with a sports medicine physiotherapist, but then you may migrate towards a medical practitioner with expertise in sports medicine. And I think you also have to think about the fact that, as I said, you graduate from veterinary school with a veterinary degree, and you are supposed to be competent to deal with everything related to horses. But you're not, in essence, because you need to learn a lot more. And certainly I have employed many new graduates for a period of a year, and they're have learned exponentially during that year. And at the end of that year, I felt they're really competent to go out and deal with the world. So somebody who has done an internship and or a residency, so further training, is going to be much better off able to be providing adequate care for your horse than somebody who's just graduated and not had any further education. There is the opportunity to acquire specialist qualifications. So relevant to sports horses, there is the diploma in equine veterinary sports medicine and rehabilitation. So if somebody has acquired their diploma, then they will have done a 3-year residency of intensive training in sports medicine, all aspects of it, and rehabilitation, and they will have undergone examination, and therefore they can be called a specialist in equine sports medicine. You have some self-styled so-called sports medicine specialists who tend to be people that travel around the country, looking at sports horses, making on-the-spot diagnoses, injecting joints, and maybe successfully managing the horse. But they are different from a sports medicine specialist who has undergone specialist training and examination. So I think you need to look at the experience and qualifications of the veterinary surgeon. But also it's important that you get on with the veterinarian, that you can communicate with them and they can communicate with you. Because if you feel that the veterinarian is not listening to you, or the veterinarian does not explain things adequately to you so that you can understand and make decisions based on what you're being told, then to me, that's not a satisfactory relationship. And therefore, that person is not going to be right for you. That doesn't mean that they're not going to be right for somebody else, but you have to be able to have a rapport, I believe, with your veterinarian, as does your trainer, as does your physiotherapist, so we can all work together collaboratively as a team. And if that communication breaks down, that's when problems tend to arise. So you need somebody good with experience. And I would also say, if they're a sports medicine person, I would say, do they ride? Do they understand the sport with which you are engaged, be it you may be an endurance rider or a show jumping rider, or just a trail rider, but the veterinarian has to understand what your aims are for your horse. And if they have personal knowledge of the sport, and particularly if they're a rider, I think they're in a better position to understand. And I always think that when we're talking about the communication between the rider and the veterinarian, we've also got to talk about money, unfortunately, because veterinary costs are not cheap. And there has to be an understanding between you in terms of how much you can afford to spend in investigation and treatment. And then the investigation and treatment has to be targeted to correspond with that. Because for some people, cost is no object. They will spend anything. But there are other clients who are less fortunate. They may be working full time in order to be able to keep their horse, and their budget is limited. And therefore, as a veterinarian, we have to tailor what we do and understand that situation. So again, it's communication that's so important.
Yeah, that's such a good point. As a trainer, I sometimes feel that that's part of, I always feel that that's part of my job as well, is to tailor the services that I provide to the budget of the person that I'm working with. Because if I start down a road that they can't afford to go all the way down, it's really a waste of resources and time, and going to end up being frustrating for everyone. And I do find that maybe the most important aspect of that part of my job is working with a veterinarian who also appreciates the importance of that. I know one of the things that I've heard from people who've seen the film is, that vet exam that Galena went through with you and Jim was very extensive, and that a lot of people can't afford to do a full day long exam in the same way that we did. But there, I've been in situations where, you can say, okay, well, we can afford to do this much. Where does it make sense to put those resources for the best chance at finding a solution? And if we don't find a solution, what are the next steps that we can do that are not going to be so expensive? Because there are ways, obviously, if you can throw everything at a problem, that's your best chance. But there are ways to, use time, examining things over time, giving feedback to the vet in between visits, maybe making different changes with the saddle, with the shoes, those kinds of things that are going to happen regardless of what the issue is, and seeing if those things have effect. So having that team approach of a trainer and a farrier and a saddle fitter and a veterinarian that all can work within the framework that is realistically going to be something that is going to yield results is really important. And you mentioned having a vet that rides. Now, I've had a range of vets through my career, everything from I love working with you because you are a high level eventing competitor, and so you do really understand not just dressage, but also jumping and conditioning and all of those other things. That's pretty rare in my experience that you find that. I think most people who go into equine medicine have some horse experience, but not always. I have had experience with vets that really are not horse people. And that's, I would say, that rules out a vet for me if they're not really, I don't know why they go into equine medicine if they're not really horse people, but I have had that experience with someone doing a pre-purchase that didn't seem to really be comfortable around horses. That's obviously the other end of the spectrum. But I think the middle ground there would be someone who may not be a high level competitor or a really talented trainer, but someone who's interested in the topic, interested in learning, and someone who has, outside of veterinary medicine, pursued education in the discipline that you train or ride. And so that's part of getting to know a veterinarian is you can kind of feel them out. Is there a way that you can approach a veterinarian to find out what their experience is that's not going to feel invasive or be off-putting to a veterinarian if you're going to ask them about their horse experience?
That's a good question. I think you can approach it in general terms and say, are you genuinely interested in lameness investigation? Because if they shrug their shoulders and don't show a passion, then probably they're not going to be the person. If we're just talking about lameness, they're not going to be the person for you. Whereas if they say, oh, well, I really find that a challenge and I'm continuing to learn and show enthusiasm, which is how I've always felt about the job, then that is a very positive thing. And you can just simply ask them, do you feel comfortable doing nerve blocks? Do you routinely do nerve blocks in your day-to-day work? And if they say yes, that's a tick, a big tick. And if they say no, then it's no. Because the principle of lameness diagnosis is once you've done your clinical assessment, there may be some cases when doing your clinical assessment, you've got all sorts of clues about what the problem is. But in many instances, there are no external clues. And therefore, you have to go down the route of, first of all, determining the source or sources of pain, because that's the number one thing for lameness diagnosis. First, find the source of pain. And when there are no localizing clinical signs, then we have to use nerve blocks. So the veterinarian must feel comfortable in being able to do them. And some veterinarians are physically find it very difficult because they can't bend down adequately or they can't move quickly enough. And one has to say that doing nerve blocks is a potentially hazardous procedure. And that means that you as an owner have a responsibility to have adequately trained your horse with respect to it standing when you want it to stand still, for example. Something very simple in principle, but doesn't always happen in my experience. So as an owner, you can do something to help the vet. But I mean, I know vets I know several vets who just don't feel comfortable nerve blocking hind limbs. They've never done enough of them and they are frightened. And then we have to really respect that, but they're not going to be the person that's going to do the job for you. So I think you have to have a fairly open discussion, but just say, are you comfortable doing nerve blocks?
Yeah.
If the answer is yes, that's great. And if the answer is no, then I think you've got to find somebody else.
That does seem to be, I think, maybe the single most frequent topic of discussion in all of these lives that we've done is finding a vet that does nerve blocks. I think we've specifically tried to cover topics that people struggle with finding answers to, and we've done lives in the past on head shaking and kissing spines and some of these areas where it is difficult to find vets that are willing to do nerve blocks, and I get asked that a lot. How do I find a vet who is willing to do that? To do nerve blocks, particularly in spines or necks or other areas that maybe aren't as common. Is there sort of a level of experience that you or a particular type of training that you look for, or is it do you really have to go on the word of the veterinarian that you ask?
I think you have to go on the word of the veterinarian, because I think one has to recognize that at veterinary school, you don't get a comprehensive education in this. So you've either to educate yourself or you've got to find alternative resources. And there are some books, but now I'm very pleased to say, having been part of the creation of it, there is an online course available for equine veterinarians, a very comprehensive course about lameness investigation, run by the Equine Practice Company, which is an Australian-based company, which provides a really comprehensive background to both clinical evaluation and how to perform all the routine and the less routine nerve block techniques. Now, it doesn't necessarily make you competent, but it's a good start.
Yeah, that's huge. I think we'll make sure that information about that is available, because I think there's a lot of veterinarians that would probably benefit from knowing more about that. And I think if horse owners know that that is a resource and can suggest it to their veterinarians, I think that would go a long way towards helping a large number of horse owners, because it does seem that, I know particularly being in the US, it's just a chronic issue of people not being able to find veterinarians who are comfortable doing the kinds of nerve blocks that a lot of horses benefit from. And it wasn't that long ago that we didn't really do spinal diagnostics on horses, because it just we weren't able to do imaging, and we weren't able to get the nerve blocks. And the fact that those tools are available now means that we're in a period where we really need to encourage people to ask for those services and create opportunities for more veterinarians to be able to offer them. So besides nerve blocks, and besides being a knowledgeable horse person who rides, what else can we investigate? What other questions do we want to ask?
Well, I think I would want to know, is the veterinarian prepared to watch you ride the horse? Because so many problems are much, much more obvious when the horse is ridden. And if your problem is when you're riding a horse, then as a veterinarian, to understand your problem, I think you have to see the horse ridden. And I don't see how you can understand the problem otherwise. And it may be that, for example, the veterinarian may see no lameness in hand. Their horse may show a very low grade right forelimb lameness on the right rein, on the lunge, on a firm surface, but not on a soft surface. And they may assume that that's the cause of your problem when riding a horse. And that's not necessarily the case. That may be a completely coincidental finding. So I think personally, it's important that the veterinarian is prepared to see the horse ridden. And they may have facilities at the clinic on which they're based to see the horse ridden, or it may be necessary for them to come to your barn to see the horse ridden. Mm-hmm. You need to know that they're prepared to do that and invest the time. Now, you have to expect that you're going to have to pay for their time, obviously, mm-hmm. But in order to reach a satisfactory conclusion, unless the horse is very lame on a single limb in hand, in which case, obviously, you can investigate it in hand. You don't need to go down additional routes. But if your problem is something that you're finding it difficult to turn to the right, but otherwise you're not aware of anything else, then I think the only way that I could investigate that problem would be by seeing the horse ridden and observing probably some lameness when it was ridden that I couldn't see under other circumstances. So I would want to know that the veterinarian, he may come and do an initial examination, maybe, or you may take the horse to the clinic and they do initial examination. But then I've got to know that they're going to put or provide sufficient time to do whatever nerve blocks are required. Because if the veterinarian is under time pressure, then they're going to rush. And with rushing, I think you come to erroneous conclusions. So, for example, I saw a horse very recently which had a history of left forelimb lameness, and the appearance of the horse was suggestive that it probably had foot pain. A veterinarian had looked at the horse, had done a nerve block of the foot, concluded that that was negative, and rapidly went up and leapt up and blocked the horse just below the back of the knee, after which the horse improved and switched to the other limb. And then they did some imaging of just below the back of the knee using ultrasound and said they couldn't really see anything conclusive. And they assumed that the horse must have a low-grade suspensory ligament injury and advised rest. Now, the clinical signs were not consistent with suspensory injuries in the top of the leg because the lameness was worse on the inside of a circle on a firm surface, whereas upper suspensory ligament lesions are usually inducing forelimb lameness, which is worse with the leg on the outside of a circle.
Mm-hmm.
And the problem was that the veterinarian had jumped to a conclusion, having watched the horse just do one circle on the lunge, that the horse was still lame. When I reviewed the case recently alongside the same veterinarian and said, let's just wait longer after he'd done the nerve block, the horse was sound after blocking the foot and in fact went lame on the hind limb. So if you rush, you're going to reach erroneous conclusions. So the veterinarian has to be prepared to spend sufficient time. So to set aside enough time to do the nerve blocks on however many limbs the horse may be lame on. So you may not be able to do that on day one when he examines the horse because he might not have allocated sufficient time. But one would hope that when he or she comes back, they will have then allocated sufficient time to do the job appropriately. And if they're going to see the horse ridden, I think that it is important that you as the rider feel satisfied with the outcome, that you feel that the horse has improved, because the vet can have bias. He wants to get the job done. He wants to say the horse is better. And you may have bias inherently because you want a specific diagnosis. So you have to work together. And if you as a rider feel that the horse is not adequately improved, then you need to have dialogue between you and the vet. Now, in saying that, if the horse has had problems for quite a long time, and particularly if it's been involving more than one limb, the horse may have lost some muscle mass. And when we've taken away the pain, although the horse may feel it wants to move better, it may not have the physical musculoskeletal strength and coordination to do that properly. So the rider may say, well, it feels really different. It feels weak now. But that doesn't mean it hasn't improved. It just means that it hasn't got the musculoskeletal strength to support it. And then you may have a horse with a chronic problem who's still got some myofascial tension, and that may be restricting its movement to some extent. So you're not necessarily looking for the horse to go absolutely 100%, but there needs, as I say, to be dialogue between the veterinarian and the rider as to what degree of improvement has been observed. Bearing in mind that if we're relying on the ridden horse, we have the complicating issue of the saddle as well, and the saddle may be contributing to discomfort as well. And therefore, and this is a little bit wishful thinking, I think, ideally, your vet should be able to assess saddle fit. Not how to correct saddle fit, but to assess, is this saddle fitting properly? Right. Could it be causing pain? And we looked back retrospectively at 150 horses consecutively that were presented with performance problems. And despite the fact that the majority had had recent professionally assisted saddle fit, in 37% of those horses, the saddle was a contributing factor to the horse's abnormal movement and abnormal behavior when ridden. So I think it's important that we bear in mind that the fat saddle may be a contributing issue as well. And that's again when there's so much importance of dialogue between the rider and the veterinarian. So if I'm going to say to the rider, well, do you have even rein tension now? Or is the horse still hanging on the reins? Or is the horse avoiding taking a contact? Because that's useful information to me to tell me whether or not the horse is improving or not.
Yeah, it really underscores what we talk about all the time, which is that team approach. And our business and nonprofit are called Train with Trust because having, it all comes back to relationships, your relationship with the animal, but also your relationships with the other people. And, I was just thinking as you were talking about, I really do think that in the last few years that has become, in my mind, a non-negotiable term is that if I'm doing a lameness exam on a horse, the vet really needs to watch that horse under saddle. And it's still not standard, at least where I am. It's not that common, and it's such an easy thing for veterinarians to incorporate. I mean, it doesn't really take that much specialized knowledge or really that much more time to add that. And it's something that even if the veterinarian, you can ask about their experience and their comfort level with certain things, but it's a black and white question. Do you watch the horse under saddle when you do a lameness exam? And if they say no, to me, that's, move on to the next option, or talk to them about why not and whether they would be willing to. And in terms of, I'll steer people back to the live we did about saddle fit, which I think was almost a year ago. Well, we can post a link back to that, but it's really important that you educate yourself on saddle fit so that you're not at the mercy of a saddle fitter who may or may not be trying to sell you a saddle. You need to know what things to look for yourself, and what behaviors are common in saddles that don't fit, and maybe ruling some of those things out before you even bring the vet into the equation is a way that you can save time, make the job for the veterinarian easier, and be on the same page. And if you can get a saddle fitter who is willing to talk to your vet, same with all the other team members. I tend to like to work with saddle fitters and manual therapists, because that's, to me, one of the best ways to diagnose whether making a change in the saddle fit is making a difference or not, is, whether there's a change in the muscling, a change in where there's pain or lack of pain. It really comes down to having those relationships. And a lot of times as a trainer, I tend to be sort of the connecting tissue between a lot of those people. An individual horse owner may not have a lot of opportunity to build those relationships with all of those different professionals with different horses and go through different things. But as a trainer, you really should have many opportunities to work with different people and build a rapport and build trust with them, that you trust their expertise, but also that they trust your input. You're one of the very few veterinarians I know that will actually get on a horse on occasion. And I have had other vets that are good enough riders and knowledgeable enough that it's very helpful to have them get on. But usually it comes down to you being able to communicate as a rider what you're feeling, and having the veterinarian be able to understand what you're telling them, and trust that your feedback is valid, that you're not just complaining about something, you're actually giving them useful feedback, that's something that is a problem that they can address and make different through nerve blocks or through treatment.
And I think we also have to think, we talked before about budgetary constraints.
Yeah.
Now, if we, for example, got a 17-year-old trail riding horse that comes out stiff and maybe after 45 minutes or so is moving a little bit more freely, maybe we don't have to go through a detailed clinical investigation. We may go say, what we want to do is do a thorough clinical evaluation to make sure that there's not likely to be some soft tissue injury, which is likely to possibly be exacerbated by work. And if we rule that out to our best of our ability, we may then say, well, okay, maybe just the use of pain relief, the use of phenylbutazone, for example, may be the most pragmatic approach. Phenylbutazone is cheap. It's an effective form of pain relief in many horses, and will enable that horse to work comfortably, and to keep it mobile is probably very beneficial. So I think we have to adapt the investigation according to the horse in front of us. And that's going to be different in a 4-year-old potential upper level show jumper versus a 14-year-old pony club pony that is doing a great job but just comes out a bit stiff. So we have to tailor the investigation with respect to what we see in front of us.
Yeah.
And another thing which I
I'll
think
just
is
jump in
important.
real quick and say that you did write up a post about using Butte for diagnostics, and we'll make sure that we repost the link to that for people, because it's another thing that's come up quite a lot, of the effectiveness of Butte trials and how to do them.
Yes, so I think we have to be a little bit careful differentiating between a Butte trial, when we're saying, does the horse have pain or not, versus maintenance with phenylbutazone to enable the horse on a daily basis to feel a bit better. And so it can move better and be more comfortable to be ridden, and probably more comfortable for the rider to ride it as well, because then you'd be using a lower dose as a maintenance dose.
Yes.
But another thing I was thinking about with respect to the veterinarian is that the veterinarian must also be prepared to be honest with you in terms of the likely outcome, so that you don't feel that you are compelled to spend lots of money when the outcome may be poor. So you need to feel comfortable with the advice that you're being given. And also, you need to feel not affronted if the veterinarian says your horse is obese and your horse has got subclinical laminitis and it's your management. You must take responsibility for your horse. And if your horse is obese, then you've got to do something about it, because nobody else can do anything about it than you, because you provide the food for the horse. So I think that you need to have a relationship that you can trust your vet, that they're going to be telling you the right thing. They're not going to make you overspend when you haven't got the money, but they're also going to be truthful with you. And if they say the horse is a beast, you must do something about it. You mustn't just go off in a huff. You must say, oh yes, he probably is a bit fat. I wonder why. How can I change my management? And get help for the change in the management too.
A lot of the conversations surrounding just management and welfare can be very fraught for people, and we're all trying to do our best, and a lot of us are working with information that we were taught at a time where we didn't know as much. I think that's something that that as a trainer, we talk about the importance of education and keeping up on the latest things for vets, but it's true of owners as well, that what we were taught, how we were taught to manage our horses, and some of the nutritional things that we just take for granted, those things have changed, and vets can be a great source for the latest information at times, but it's also up to the owners to stay with the latest information and update their belief system about the best management practices, because it can be easy to be defensive, but the truth is that we're all trying to do the best we can, and that information is changing. And what we were taught when we were growing up is a lot of times not the best way to do things now. And the horse world in particular, I find, working with different species, that horse people are very, very attached to the way that they do things. And
absolutely, there's so many myths, like the horse is a naughty horse, is an unwilling horse, is a lazy horse, which are all synonyms for probably saying that the horse is uncomfortable. And maybe that brings us on talking about innovations, to talk a little bit more about ridden horse behavior, and perhaps Megan can provide some slides, because I think that we now realize that ridden horse behavior is a really important aspect in terms of helping us to define whether or not horses have got musculoskeletal pain. And we produce this ethogram, this series of 24 behaviors. And if a horse shows 8 or more of those behaviors, it's highly likely that it has musculoskeletal pain. So I mentioned before, we did a study, or a retrospective study, of 150 horses. So these were horses which presented with poor performance, Some of them were not overtly lame. More than 30% were not overtly lame. They may just show poor hind limb impulsion and engagement. You could not pick a lame limb. And when we looked at the overall lameness grades, the median, that's the most common grade of lameness, was only 2 out of 8. So these were horses with relatively mild lamenesses, and this was the worst degree of lameness that was seen when they were ridden. And yet many of them showed 8 or more of the 24 behaviors. And if we successfully remove the pain using nerve blocks, using diagnostic anesthesia, then we expect to see a reduction in the scores. So here we see the 150 horses, and the red box on the left represents the scores before the nerve blocks, and the magenta box on the right represents after. And the box represents the middle 50% of the scores. So the middle 50% of the scores of before we used the nerve blocks were between 8 and 11, whereas afterwards, the middle 50% were between 1 and 3. So we saw a dramatic decrease in the total behavior scores. Now we can see on the right with the circles that there are a few outliers that after the nerve blocks still scored 8 or more. So we've got an 8, a 10 and a 12. And those were horses which had a component of neck pain and nerve root pain, which we cannot abolish using nerve blocks. So that explains why we've got some outliers there. So let's go to the next slide. And in this next slide, we're going to see each of the 24 behaviors along the horizontal axis, and the frequency of each behavior is on the vertical axis. And the white boxes represent before the nerve blocks, and the blue boxes represent after the nerve blocks. So we can see that for the vast majority of the behaviors, the blue boxes are very substantially smaller than the white boxes, showing that we've got a marked decrease in the frequency of each of those behaviors. So I think that this shows beautifully how the use of the ethogram can be helpful not only for identifying the presence of musculoskeletal pain, but helping a clinician know whether or not they have found the primary sources of pain adequately by the use of nerve blocks. Because if we don't reduce the scores dramatically, then we have to be asking why. Now, some of the horses had ill-fitting saddles, in fact 37%, and we changed the saddle as well. So these results represent both the nerve blocks plus the change of saddle. So we abolished rearing, we abolished bucking, we abolished horses going too slowly. We nearly abolished horses going with a rushed gait or with an irregular rhythm. We nearly abolished exposure of the white of the eye. So we can see dramatic reductions in each of those behaviors, which, as I say, highlights how valuable a tool that I believe this is. And it certainly helps me. If I haven't got a sufficient reduction in the behaviors, then I have to be asking why. I must be missing something. And that's an important thing, I think.
Yeah, that's huge. That's so dramatic. And this really illustrates why I was saying, to me, it's a non-negotiable thing that a vet is not evaluating soundness while a horse is being ridden. It's like leaving all of this on the table. It's really, I can't understand why you wouldn't use this tool when it's right there and it's so dramatic.
Yeah. So we then, I guess, have to say, well, let's assume that the veterinarian has determined the source of pain. What comes next? And then the next stage, obviously, is trying to find out what is the cause of the pain. So we're then going to use diagnostic imaging. But I think it's really important that when we use diagnostic imaging, we don't use it as a fishing tool. because as a fishing tool, it's not very reliable, which is why it's so important to do the nerve blocks.
Mm-hmm.
So, for example, the rider may say, well, the horse looks okay in hand, and the vet agrees, I can't see any lameness in hand, but it's got a problem in its behavior or its performance when it's ridden. And what's the difference? It's me on the horse's back, and the owner may request a back x-ray. Let's go to the next slide. And then we take a back x-ray, and these are back x-rays acquired by a practitioner who suggested that the closeness of the spinous processes indicated by the 2 yellow arrows was the cause of this horse's problem. But that's not necessarily the case, because we see many horses with close spinous processes like this with no other secondary bony changes when they are of no consequence. So it's really important that we have localized pain to an area, and then we image that area, and we don't just go on a fishing imaging exercise. And I would say the same applies to advanced imaging. People tend to think, oh, my horse is lame, let's do an MRI. But you have to realize that if you want to do an MRI examination, magnetic resonance imaging examination, you need to know where to look. So are we going to image the foot, the fetlock, the knee? Where are we going to do it? We have to have done nerve blocks first to determine where we're going to use that imaging. And then, just as I said that there are people that are skilled at looking at lame horses and doing nerve blocks, that doesn't necessarily equate with the fact that they are skilled at looking at all different imaging modalities. So it may be that you need to also have the expertise of somebody who is undergone specialist training in image interpretation to facilitate correct interpretation of the images that are required. And with the internet, this is now easy because we can share images very, very easily. So if ever I've had a question mark about the interpretation of images, I just send them to several friends around the world who I know have got expertise in that area and say, hey, what do you think? How would you interpret this? And it's so important, I think, to ask for second opinions if you're not sure. And I don't think you should question your vet. If your vet says, I think we need a second opinion here, that's something you should celebrate, because he or she is recognizing that their knowledge is limited in this area, but they want to learn more and they want to have the advice of an expert. And that's a good thing. And that should be encouraged, I think.
Absolutely.
And let's just go on to the final slide, I think. And this is a hock x-ray. This is looking at a hock from front to back. And this horse has got a large, moderately sized bone spur projecting from the central tarsal bone, overlapping the third tarsal bone as indicated by the yellow arrow. Again, it's important to know that we can see this in clinically normal horses, and this doesn't necessarily progress. It's not necessarily the cause of lameness. The joint spaces look absolutely fine. Yes, periarticular osteophytes may reflect slight joint instability, but they don't necessarily mean the horse has got a current joint problem. So just because we see changes like that, we mustn't jump on them and overinterpret them, because they may be there without being of current clinical significance. One also has to realize that looking at soft tissues using ultrasonography is an acquired skill. None of us learned how to do it at veterinary school. Those of us who are older, those who are younger do get the basics, but unless they go on a specialized course, they're not going to have sufficient skills to both acquire diagnostic quality images and interpret them. So for each of the imaging modalities, some degree of expertise is required.
Yeah, I think that's really important. I think a lot of people don't realize that, and it's another area where having a team of people with that have more experience with going through this process than the average horse owner is really important, because I know I've been in this industry for, 40 something years and have seen horses flunk pre-purchase exams based on x-rays who go on to have successful careers. And I've seen horses with clean x-rays that are passed end up, having problems because things weren't, other behavioral things were ignored, or, soft tissue signs were ignored. And again, the technology has changed so much. And I think it's really important. I don't think a lot of people understand that it is not a skill that every vet has, and that it is okay to have the images evaluated by an expert in that field. I have a friend right now who has a broken ankle, and they missed one of the fractures when they looked at her injury at the hospital. And then even after it had been diagnosed by a radiologist, when a follow-up report missed it again. So even in human medicine, this is, as much an art as a science sometimes. And it really is important to get those opinions. And in my experience, getting those backup opinions, even if you don't have friends all over the world, it's not that expensive to get radiographs or imaging read by someone else, and see if there's something, or see if something that has been found is as significant based on the clinical signs as one thinks. So I think that those are more important questions. And again, that team approach and having people that have more experience than you do going through these things is just really critical to the process. Okay, so, and in terms of imaging, do you recommend that, do you feel a strong difference between like when imaging is done on location versus taking a horse into a hospital to get certain kinds of imaging done?
I think with respect to x-rays or radiography, with the modern digital systems, we have advanced hugely in the last 10 years.
Mm-hmm.
And therefore, if the veterinarian is paying attention to detail in terms of angle of the x-ray beam and the position and his exposure factors, then they should be able to get very good quality images in the field. Likewise with ultrasonography, if you've got a decent ultrasound machine, and whilst you pay for what you get, the modern ultrasound machines are basically pretty good at the middle level of the market, and those are very portable, and you should be able to get good quality images in the clinic, at the farm or at the farm. With more advanced imaging modalities, or with, for example, examination of the back, you're probably going to need to go to take the horse to a clinic where they've got more powerful equipment, or where they have MRI or computed tomography, that's CT. That will be an in-hospital or in-clinic procedure. Mm-hmm. And you will have to expect that your horse will probably have to stay there for the day whilst the images are required, because it's quite time consuming. And then whoever's interpreting the images will want to read the images ideally before the horse is discharged, in order that they can be sure that nothing else is required, or no follow-up other imaging is required. So, for example, if the horse had fetlock region pain, nothing was found on x-ray, nothing was found on ultrasonography, and then using MRI something was found, you may say, okay, well, let's go back and look more carefully and acquire additional x-ray views just to see if we could see this on x-ray, so we could use x-rays as a follow-up tool. So I think as an owner, you need to expect that one imaging modality may not give you all the answers. Mm-hmm. And you may need to come back and use the same imaging modality again, just acquiring different views in order to find the lesion that was found with more advanced imaging.
Mm-hmm. So I don't think any discussion about diagnosing performance issues would be complete if we don't also touch on the topic of gastric ulcers. And, you know, I'm interested in your perspective on this because we've talked a lot about specializing in things that are really orthopedic centered, and really, you know, some of these issues are very commonly associated or at least blamed on something that is really not orthopedic at all. Can you talk a little bit about how you approach the possibility of performance issues being caused by ulcers, and how common that is, and whether there's some particular approach that you would recommend in terms of ruling that out?
Well, the only way you can rule in or out the presence of ulcers is by gastroscopy. That's putting in a flexible telescope into the horse's stomach and inspecting the stomach. And assuming that the horse has been fasted for 12 hours beforehand, it's relatively easy to evaluate the stomach and to determine the presence or absence of ulcers. But then the big question is, why are the ulcers there?
Right.
Is it related to the horse's management? Is it on too high a starch diet? Is it under a lot of stress? Is it not having enough turnout? Or is it stress induced by chronic pain? Now, one you can take is saying, okay, let's change the management if the management isn't optimal. Let's treat the horse most appropriately with, for example, omeprazole on Gastrogard and see what happens. And particularly with squamous ulcers, then change in management plus omeprazole may result in resolution of the ulcers. However, in many instances, we know that the underlying stressor is related to chronic pain. And unless we identify and resolve that chronic pain, the ulcers are likely to recur. And in fact, there are very few documented cases where gastric ulceration is the primary cause of poor performance. And therefore, we have to take care in the overinterpretation of the clinical significance of gastric ulcers. And fine, treat them once, but if they recur, look for another reason as to why they are occurring. Because omeprazole is not cheap by any stretch of the imagination. And there's no point treating the horse 4 or 5 times over and saying, well, they're coming back. There has to be a reason why they're coming back. And the most common reason is underlying musculoskeletal pain.
Yeah, I think that's that may be sort of an issue of epidemic proportions at this point. I see a lot of performance issues being blamed on ulcers, which, you know, are rightly being diagnosed and treated, but very often the question is not being asked, you know, what can we change to prevent them from coming back, rather than just treating. It's kind of like continuing to put a Band-Aid over a wound that keeps reoccurring. At some point, you've got to figure out what's causing the wound.
Yes, and I think this has been both client-led, because clients have been made very aware of the presence of ulcers and how they can be managed. And so the horse is a bit grouchy when it's tacked up and it's not performing very well. So they ask the veterinarian to perform gastroscopy. They do what they're asked to do, and they identify ulcers and they treat the ulcers.
Right.
Absolutely, that was fair enough. That was what they were asked to do.
Yeah.
I think the internal medicine specialists now are very aware of the fact that musculoskeletal pain is a fairly common underlying cause. So they are more likely than the general equine practitioner to say, hang on a moment, why are these coming back? It may be because there's orthopedic pain. Maybe I need to have some help from an orthopedic expert. Whereas the general equine practitioner, I think, sometimes doesn't stop to think and ask the question, why are these ulcers coming back?
Yeah, and again, I would circle back to the problem that the way we were taught is not necessarily the most up-to-date information, and sometimes the way we manage horses is not, um, you know, the way we were taught was best is not necessarily best, and so you need to be, uh, willing to look at it, take a step back, and look at the horse's situation from a different perspective. One of the things I wanted to also come back to is you had mentioned that, like when we were talking about nerve blocks, that if a horse is not trained for appropriate behavior for husbandry procedures, sometimes the diagnostic process itself can be very stressful for the horse. And, we, part of our mandate in terms of offering access to education is we really encourage people to include training for husbandry and management with all their other training, so that the horse's day-to-day handling and treatment of whatever issues that come up don't contribute to the stress and to the to possibly development of ulcers, or they can also contribute to having a hard time finding a vet that will treat your horse, or do the diagnostics, or successfully be able to complete the diagnostics if you don't train for those things. And in zoos, they train animals to cooperate in their care, and there's absolutely no reason that we shouldn't be also doing that with horses, other than the fact that horses often let us get away with using force and control and sedation and things like that to allow us to do invasive things that are stressful for them. So along those lines, I'd like to sort of wrap up with talking about, again, fewer and fewer people are becoming equine veterinarians. It's obviously a very stressful profession. So I want to really emphasize all the things that owners can do to make that job easier and safer and more rewarding. So can you talk a little bit about all the things that we can do to help our vets be more successful and have a better experience with their horses?
Well, I think that you can make the job easier for the vet by communicating well and having your horse appropriately trained so that it will stand still. It's not going to trample me. I'm not going to feel scared by it. In saying that, there are going to be horses that are going to act adversely to needles, particularly needles placed in hind limbs. And I would not expect an owner necessarily to be able to train the horse appropriately for needles. But maybe together, if we know the horse is needle shy, we can work together and we can reverse that needle shyness. I think that owners should not be excessively demanding. There are some things that are emergencies and there are other things that are not. And if you put your veterinarian under excessive stress and say, I must have you here today, although the problem has been there for 2 weeks already, that's not going to be the best way to engender a good relationship with your vet, particularly if you're asking them to come at the end of a busy day. So I think you've got to treat your veterinarian as an individual. They should be a friend, really, and you should have that rapport. And so don't treat the vet as an adversary. That vet should be your friend working to do the best with your horse. And don't play one vet off with another. So if you are using more than one vet, be transparent so that everybody knows what's going on and you're not trying to place one veterinarian in competition with another. And it's not fair to just bring along another vet and not tell them that the horse has already had treatment of X and Y, because that actually may be bad for your horse. If this next vet comes along and says, well, I want to use treatment Z, it might not be appropriate if the horse has recently been treated with X and Y. So you have to be transparent with the people that you use and be honest and straightforward. And don't put them in embarrassing situations. Don't, for example, say, oh, I missed my vaccination date by a day. please backdate the certificate, because that's placing your vet under stress. They should never be asked to do that. That would be dishonest for them to do that. And you should never put them in that position, however much you don't want to have to repeat the vaccination course, for example. So preparing the horse, don't expect the vet to wait while you go out and catch the horse and then brush it off. Have the horse ready. Pick out the horse's feet. There's nothing worse than being asked to do a lameness examination and you find that the legs are muddy and the feet are full of mud. You might laugh, but it happens over again.
No, I think that's a great point, because I think a lot of people don't think about that.
So treat your vet as a human being, respect them, pay your bills promptly, and expect to be charged accordingly. And just, I think that relationship can be very precious. And I like to think that many of the clients that I've dealt with over the years, I remain in contact with them because they've become friends. And that's the sort of relationship I think it's nice to have.
Yeah, I agree with that. And also understand that they have lives and they have bad days, and allowing them to be a human being. I think sometimes we tend to look at our vets as superheroes, and they are just people with lives and have good days and bad days, and are affected by heat and money and all the things that affect our daily lives as well. So we have resources that are available on the Train with Trust Project website, which is trainwithtrustproject.org. We have the 24 behaviors checklist, which we've kind of covered in depth of what those behaviors are and how following those things consistently can allow you to track what's going on and give your vet really good information. We have a checklist for selecting a vet on this topic that can help you go through some of the things we've discussed today, and how to provide your vet a thorough history. Can you talk a little bit about that?
Where do you start and stop? I always think that from my personal perspective, is that it's better to have too much information than not enough. That wouldn't be the same for every veterinarian. Some veterinarians will feel overwhelmed. I've suggested there's a checklist here, which helps you to rationalize your thoughts, as well as provide them in a thought out way to your veterinarian. Because I think all this information is really useful, not just from a diagnostic point of view, but from a future management point of view as well. So this form here is downloadable from the website, and I think is a useful form.
Yes, absolutely. I think it helps even just to wrap your own mind around what's going on, because sometimes we can sort of be overloaded by all of the different thoughts and information that we gather.
Yeah. It's a very extensive form. It's going to be too overwhelming for some veterinarians, but I think personally it's useful, and as you say, helps rationalize you as the rider's thoughts.
Yeah, that's also a good point, that you can give this to your vet and they may or may not use all of the information, but it is better, as you said, to give more information rather than less.
And one other point I think is important from a good veterinarian's point of view is that they should document their results, so that if you are, for example, moving from California to Oregon, you can take the horse's veterinary history with you, which is reasonably complete. And the degree to which veterinarians record their clinical observations is hugely variable.
Yeah, that's an interesting point. And I think it's pretty uncommon to receive those records on a regular basis, but I have worked with veterinarians who will give you some sort of summary or evaluation form after a visit, and that's always really helpful. If you're not getting that from your veterinarian, is there, I guess, the best way I can think of to facilitate that would be to ask questions, communicate, and make your own notes during the appointment and after the appointments, and keep track of those things.
Yeah.
I also think another thing that we sort of don't think about a lot is video tracking of exams and appointments. And then in between appointments, I have had vets that will look at video in between appointments and give feedback on it. Obviously, you don't want to ask your veterinarian to do things that they're not getting paid to do, but a veterinarian that will evaluate video for you in between appointments, or as a way of tracking progress, can be super helpful. And that's something that's getting easier and easier to do for people to video themselves and keep records, and being able to look back and say, oh, okay, well, I don't remember what the horse was going like back then, but if you consistently and regularly do a little bit of video, it's easier to look back and think, oh, well, he wasn't tossing his head back then and now he is, or, oh, that's improved since we did ABC, that kind of thing. I think that's a way that you could make your information that you give your vet more consistent and a little bit more reliable.
Yeah.
We came off that page that had the list of resources. I don't know if we can go back to that.
We can.
Thank you. So we have the mobile field guide that illustrates the 24 behaviors, which is available as a free download on our website as well. And in addition to the 24 behaviors, we have a long list of additional behaviors. And maybe, Sue, you can talk a little bit about the value of how the 24 behaviors were narrowed down and what the value of those additional behaviors is.
Yeah, well, the 24 behaviors were determined by evaluating both lame and non-lame horses and creating a huge list of 117 behaviors, and then comparing the frequency of occurrence of those 117 behaviors in lame and non-lame horses. And the 24 behaviors that are in the final list are, the majority of which are at least 10 times more likely to be seen in a lame horse versus a non-lame horse. But there are other additional behaviors, for example, grinding of the teeth, or after exercise, standing and shifting weight between the hind limbs, which are also indicative of pain. So I think that additional behavior checklist is also worth looking at.
Absolutely. And again, falls into that category of may or may not be useful to the vet, but more information is always better than less. And it can also help you wrap your head around, what's significant, what things are changing, improving, or getting worse if you look at those lists on a regular basis and try to track the progress or lack of progress. And I'm going to throw one other thing in there because it came up. We talked about training for husbandry behaviors, and you did mention horses that are needle shy. It is possible to train horses to be desensitized to needles, and it's another thing that Megan did a lot of when she worked in zoos. And we do a whole workshop on cooperative care. We have videos of animals that are choosing to inject themselves, move into needles, and it is possible to counter condition the aversion to needles, and that's something that we offer remote coaching on. We can do through video. So if you have a horse that is really averse to needles, or you want your horse to be easier to handle for the vet, you can reach out to us and we can help you with a behavior plan and how to systematically break down that behavior and make it less aversive for the animal. And I think that's valuable to any horse owner, but particularly if you have a horse that's very difficult for the vet to manage, please reach out to us. We can point you in the direction of some free resources, or we can work with you one-on-one remotely to work with your horse. Is there anything else that you wanted to mention on this topic?
No, I think I've said enough probably. I would just say keep looking and keep learning. To me, it's so important that everybody keeps learning. That's the rider, the trainer, the owner, the veterinarian, and everybody else that's involved in their care. We can never stop learning.
Yes, I agree with that, and never stop building those relationships and trying to connect with the team members that have the skills that you don't have, because we know no one knows it all, and that's why we really advocate for a team approach to equine welfare, because the healthiest and happiest horses are the ones that have access to all of this knowledge and all of these skills that are constantly evolving and improving the lives of horses.
Yes, so very true. So I have been sharing, there were a couple of topics that we hit on today that we have talked about in depth. This is, we're talking about finding a veterinarian and being part of a veterinary horse care team today. I've posted those in the comments here in Facebook. Those of you who might be watching this after the fact on YouTube or elsewhere, again, if you go to our website, we also have a blog that has recordings, links to the recordings of all of these. So you can choose, from the variety of topics. We've done a lot of these wonderful conversations. Also, we always like to point out that Dr. Sue Dyson co-authored with Sue Palmer a book that was released just about a year ago, right, Dr. Sue? Yeah. So Harmonious Horsemanship, Use of the Ridden Horse Ethogram to Optimize Potential, Partnership, and Performance. You can order that online, harmonioushorsemanship.co.uk, also through Amazon. And if you are enjoying all of these resources that we are providing, and you like to support our mission of spreading this information as you're visiting us, you can also donate to us at the Train with Trust Project. For those of you in the United States, your donations will be tax deductible. And our next topic that we will be talking about in about a month, Thursday, August 15th, we're going to talk about pre-purchase exams in general, and also how, again, the Ridden Horse Pain Ethogram, or the 24 Behaviors Checklist, can be very useful in this process, should be used more, and lots of important things that you ought to know about pre-purchase exams. So that's what we will be talking about our next live, Thursday, August 15th, and we will look forward to seeing you all there. So with that, we'll go ahead and wrap up. Thanks, everyone, very much for joining us. Again, thank you, Dr. Dyson. We so appreciate your time and your enthusiasm for making the world better for horses and the people who care about them.